Interpretation of hepatitis serology has been a challenge to many physicians because they simply don't understand the components of this virus and how our body reacts against each component. Hepatitis B serology testing involves measurement of several hepatitis B virus-specific antigen and antibodies. Different serological markers or combination of those markers are used to identify different phases of hepatitis, whether it was acute or chronic infection, immunity, whether it's prior to infection or vaccination, or even susceptibility to infection. So let's get familiar with the components of the virus and how our body reacts toward those components. The first one is going to be the hepatitis B surface antigen. This is a protein on the surface of hepatitis B virus that can be detected in high levels during acute or chronic hepatitis B virus. So I need something to tell me more if it's acute or chronic infection. But mainly when you see a hepatitis surface antigen, that means that you are infectious, except when it is transiently positive within 30 days after the dose of hepatitis B vaccine. The body normally produces antibodies to this antigen. This is a normal response to infection. So we can see the antigen and we can see the antibody. The antigen is used to make the hepatitis B vaccine. We have the total antibody to hepatitis B core antigen. So we have now two types of antigen. One of them is the surface one, and the other one is the core one. When our body produces a total antibody to hepatitis B core antigen, that means that we are having some kind of immunity against the virus. The total hepatitis B core antibody indicates previous or ongoing infection, so it is also non-specific, except if we are going to search for a specific antibody. People who have immunity to hepatitis B from a vaccine are not going to develop this kind of antibody. People who have previous or ongoing infection are going to have this antibody. So IgM antibody to the core indicates that we have recent infection, less than 6 months, while the IgG is going to indicate that you are having past infection. So let's see now a table for the antigens and antibodies and make our mind about the diagnosis. If you have the antigen to the surface positive, and you have the total anti-core positive, the IgM to the core also positive. That means that you have acute infection, right? Because the IgM is positive, while the anti-surface antibody is negative, and that means that you are not vaccinated. If you have the antigen to the surface positive, that means that you had the infection now or previously. Then the total to the core is positive. Okay, I have developed immunity, but I have no idea if this immunity is chronic or acute. If the IgM anti-core is negative, that means that I'm not having a recent immunity. That means that I have a chronic infection. And again, of course, the hepatitis surface antibody is going to be negative. Makes sense. Now the third case is going to be the hepatitis surface antigen is negative. That means that I'm not infected. The total hepatitis core antibody is negative. Okay, that means I haven't developed the natural immunity. However, the anti-hemoglobin surface antibody is positive. Okay, this is now vaccination. Because we said before that we used the surface antigen to produce the vaccine. So when your body is developing antibodies against this antigen, that means that your body is now immune because of the vaccine. We have another little bit challenging cases when the core antibody is positive only. What does this mean? If I only have antibodies against the core, but the surface antigen is negative, and of course the antibody is negative, that could mean many things. And this could be conflicting for some physicians, but other physicians who are um, working in internal medicine or hepatology are going to be very expert in this. They know that when you have a resolved infection, or when the antibodies that you have gained from vaccination wane or go away, this could lead to this picture. So when we have only total antibodies to the core, this could be acute infection or resolved infection or passive transfer of those antibodies from the mother to the fetus, if we are talking about a pregnant woman, or simply this is a false positive result, or in very rare cases, a mutant strain for hepatitis. If we have everything negative, the surface antigen is negative, the anti-surface antibody is negative, the total anti-hemoglobin C is negative. That means that we don't have the virus and we don't have the immunity, so we are susceptible to have this kind of virus, and we have never get infected from this virus before. So in general, we gonna need vaccination to be protected against this virus. Now let's talk about the screening in pregnancy. Hepatitis B virus is routinely screened for in the UK. We are going to offer all pregnant women in each pregnancy and preferably in the first trimester, regardless of vaccination status or history of testing. We are going to offer them testing for hepatitis B virus. Our main aim is to eliminate the vertical transmission of the virus from the mother to the fetus. If the mother is deemed high infectious, in addition, you can give her hemoglobin immunoglobulin, hepatitis B immunoglobulin, within the first 24 hours of birth to the baby, and the mother is going to be vaccinated after pregnancy or after labor. To sum up, the key serological markers for acute and chronic hepatitis B infection is to detect the hepatitis surface antigen. Accordingly, I'm going to make my mind if I'm having infection or not, if I'm having immunity or not. There is other antigens like e-antigen. E-antigen represent the degree of infectiosity. So if you are having the antigen, that means that the virus is replicating highly, greatly, and you are highly infectious. If your body developed antibody to the hepatitis E antigen, that means that you are now low infectious or have lower infectivity. Sometimes we do the viral load, the hepatitis DNA itself. And of course, this is a direct assessment of infectivity. If you have high titr, then that you are having higher infectivity. If you found this video useful, please like and share among your friends. And if you want me to explain a specific topic for you, write it in the comment section. Thank you.